Coronavirus cases across the state are spiking, similar to the levels that we saw in May, and infections are being fueled largely by people 30 and younger. Here to talk it through with us is Dr. Daniel Koritskis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Thanks for being here.
Always happy to be here.
So hospitalizations, those are also up, but it's not like what we saw at the start of the pandemic. What is different now compared to 5 months ago? Has the virus changed, or is it simply that we just know better how to handle it?
I don't think the virus has changed. I think what's changed is the age group that's predominantly being affected this time. And younger people, we know overall, handle the infection better than older people. That's certainly no guarantee. And my heart goes out to Karen that was described in Sarah Kanji's story just a few minutes ago. But I think we're better at managing this infection in the hospital. We're lucky that it's younger people, but we really have to be concerned about the rising numbers.
Dr. Fauci said today that it could be 2022 before we start having some semblance of normalcy. Those are his words. What are your thoughts on that, and what needs to happen for us to beat that estimate?
Well, I can understand the basis for Dr. Fauci saying that. It's because even if we have a vaccine in the next week or two, it's going to take months and months for us to roll that out and for enough people to be vaccinated that we're no longer worrying about transmission. What we need to do now to bring this under control is the same thing we've always needed to do. Everybody needs to be wearing a mask. We need to be physically distanced from one another, avoiding large gatherings indoors, and we can prevent the virus from getting a toehold in other individuals who are susceptible to infection.
So let's talk about treatment a little bit. Today we learned the government reached a multi-million-dollar deal, $375 million, with Eli Lilly to develop its antibody treatment. But earlier this week we reported that one of the treatment's trials stopped because it wasn't working in sicker patients. So can you walk us through this and explain who benefits most from these antibody treatments?
Timing could be critical about when you use an antibody treatment. We don't have a complete story on this yet because the studies are still ongoing, but some preliminary data with another one of the antibodies suggested that people who did not yet have their own antibodies were the most likely to benefit. And that would be people treated really within days of becoming infected or days of being diagnosed. And that could explain why sicker patients who've progressed to the point that they need hospitalization may be beyond the point where an antibody would help them. But people who are just diagnosed and still able to be outside of the hospital and cared for at home may be early enough in their infection that the antibody could have a big role.
You remind me that there's still just so much we don't know, still so much to learn with all of this. Dr. Koritskis, thank you for your time. We appreciate it as always.
Always a pleasure.